As southern China reels from its most significant chikungunya outbreak in 2 decades, health authorities are implementing sweeping measures that bear unsettling echoes of the COVID-19 era. The outbreak in Guangdong province, particularly centered in Foshan, is the worst China has seen since its first local cycle more than 20 years ago. More than 7,000 cases reported as of early August, with over 4,000 cases in Foshan alone, have pushed city and national health systems into emergency mode. Chikungunya is a mosquito-borne virus transmitted primarily by Aedes aegypti and Aedes albopictus. Infected individuals can suffer from high fever, severe joint pain, rash and fatigue, with joint pain sometimes lingering for months or years, even though fatalities are rare, around 1 in 1,000. The illness is not spread person to person, but through mosquito bites that pick up and transmit the virus in urban cycles. Chinese officials believe the outbreak was triggered by imported infections, possibly exacerbated by warm, rainy conditions that spurred mosquito breeding in the summer months under China's typhoon season. Local transmission then accelerated rapidly in Foshan, where cases skyrocketed from under 500 to nearly 3,000 in just 1 week. Shenzhen, Guangzhou, Dongguan, and other Guangdong cities have also reported scattered infections. Facing the crisis, authorities have reintroduced what some are calling COVID-style measures, including lockdown-like restrictions, public isolation protocols, and mass testing campaigns. In Foshan, mosquito-proof isolation beds have doubled to 7,220 units, and violators of public sanitation rules, like leaving standing water in flower pots or drains, may face fines up to 10,000 yuan, $1,400. In addition to conventional spraying and cleanup drives, public health agencies have turned to creative biology-based interventions. Officials are releasing predatory elephant mosquitoes, which do not bite humans but feed on disease-carrying larvae. They're also introducing larvae-eating fish into local ponds to reduce mosquito breeding grounds naturally. Global fallout is also brewing. The U.S. Centers for Disease Control and Prevention (CDC) is considering issuing a travel advisory for China, warning travelers of a growing risk in Guangdong from mosquito-borne illness. This reactive posture follows warnings from the World Health Organization (WHO) about increasing global chikungunya transmission and the potential spread to non-tropical regions as vector habitats expand, especially amid climate change. Currently, 2 vaccines, Ixchiq and Vimkunya, have received regulatory approval in the US and EU, but are not yet widely available in China or most of Asia. Health experts continue to emphasize mosquito control and personal protection, removing stagnant water, using repellents, screening doors/windows, and wearing long sleeves during high mosquito activity times. This outbreak exposes the growing threat of vector-borne diseases in unpredictable climates and the limits of health systems unaccustomed to aggressive mosquito-driven epidemics. While China's response, with its blend of civic restrictions and biological innovation, echoes strategies used in COVID-19 management, it underscores the urgent challenge of preventing similar outbreaks in South China and globally.